right now. We're going to get started. So we are talking about juvenile arthritis, and we're going to cover a few various aspects of the condition and how to go about managing it, just to help you understand it a little bit better. I do want to, I guess, put out this disclaimer here is that every effort has been made to ensure that this information is evidence-based. We've done the research to make sure it's in line with the guidelines. If you do have questions relating to individual treatment, and that specifically goes to like medications and specific kind of aspects of your child's condition, I would encourage you to just make sure that goes to your treating doctor, your primary healthcare physician. And just a quick welcome to Amy and Dean and Catherine. Hi, it's nice to see you here. If you all have questions that come up throughout tonight's presentation, what I might do is I'll encourage you to ask them away in the chat box that we've got in the Zoom bar. It should be at the bottom of your screen, but if you pop all your questions in there, what I'll do is at the very end of the presentation, I'll come back and revisit some of those, just bearing in mind that we are limited in what advice we can give and what questions we can answer. Some of those may need to be directed to the rheumatologist or your primary healthcare provider. So tonight we're going to dive into a lot of different aspects of juvenile arthritis. From speaking to some of you, this is, until your child was diagnosed, we didn't really know much about this condition. So I hope that what this presentation can do is help you understand the condition a little bit more. We can understand practical ways to manage it. So what we'll do is we'll explore some treatment options. We'll talk about medications. And we will talk a bit about how the complications that can arise, like uveitis, just things to be aware of. And then we'll talk a bit about physical activity, nutrition, occupational therapy, school support, and just ways we can help your child cope with the daily challenges and impacts of juvenile arthritis. At the very end, we'll go through some of the general support services and the groups that are around. And then I'll talk to you a little bit more about the supports that our organisation offers. So let's get started with, well, what is juvenile idiopathic arthritis? I do want to say it's juvenile because typically the onset of symptoms comes before the age of 16 years old. And symptoms will typically last approximately 6 weeks. The reason they have a 6-week time frame there is because they need the time to actually rule out any other causes of a swollen joint. It's idiopathic because there is no known cause. Although there's been a lot of progress in the research over recent years, we understand risk factors, we understand potential, causes, but we don't have any clear understanding of what actually causes the onset of juvenile arthritis. And now it's arthritis because it's actually marked by swelling and irritation of the synovial membrane, which I'll show you shortly what that is. But that's basically the tissue that lines the joint membrane. And what we know is that there are approximately 18,000 to 30,000 Australians under the age of 24 years who have some form of arthritis. And why we say approximately is because some of the research even suggests it could be more. So that roughly equates to 1 in 500 children. And what I want to highlight here is that there is a whole community out there for you. There's a whole community out there for your child. And so you guys are not alone. It's actually one of these conditions that's estimated to be on par with type 1 diabetes. So that's very, that was one of the most surprising facts to me, because you always hear about type 1 diabetes. But juvenile arthritis is arguably one of the most under-recognized, misunderstood, neglected childhood diseases in Australia. So Although we don't know its cause again, we know its origin is in the immune system. It's an autoimmune disease driven by an attack on the healthy synovium. So I wonder if my pointer is working. But pretty much the synovium tissue lines the joint cavity, in which you can see surrounds that fluid-filled space that exists between the bones. And it's this tissue that gets attacked, which causes inflammation in the joint. So this inflammatory attack is what causes thickening of this tissue, and it results in a lot of swelling. And this can cause an overproduction of fluid. And so that joint cavity not only gets larger and larger, but it can cause a lot of pain. It can reduce the function in that joint and can affect movement. If you touch the site, you might also feel a bit of heat. And what you'll notice is that there's an increased blood flow, which is just how antibodies and inflammatory molecules affect that site. Now, this is the pathology, and it's why we talk about the importance of reducing inflammation. Reducing inflammation is really key to treatment here, because it can result in long-term damage if it's not addressed. So I'm going to go through that shortly. But sometimes in some forms of arthritis, it can even affect other body systems and organs like the eyes. So we really want to talk about the importance of stopping that inflammation. So you can see in this picture here, there's some swelling on the right-hand side and an illustration of what that actually looks like when the joint is affected by an inflammatory attack. So JIA can appear in many, many different ways, and the symptoms can range in severity. The most typical symptoms and signs of inflamed joint include swelling, pain, stiffness, and it can be mainly in the morning. There can be warmth around the joint, and sometimes it has a really painful loss of movement. And symptoms very typically can come and go, and there are periods of lots of inflammation and worsening symptoms. They're known as flares. For some kids, flares can last for days. For other kids, it can last for months. So it's very different for different kids. So flares can vary in severity as well, and they can also result in behavioral changes. So if you guys have seen your kid with a flare, it can cause mood changes, crankiness, tiredness, and sometimes they're triggered by many different factors. It could be an infection, could be virus, stress, sometimes medication changes or ineffective medications. Sometimes when children are going through puberty, those hormonal fluctuations that can occur can bring on a flare. So flares, unfortunately, have a relapse and remission course, which often follows this pattern of up and down, meaning that there are times this disease is going to be more active, causing more worsening the symptoms at times, but then it's treated to bring that activity down to a very low level. But this cycle can repeat itself over and over, and it's entirely normal to experience fluctuations in the disease activity. Sometimes they can be unpredictable in terms of when they occur, how long they last, and it can be really scary as a parent to see our child going through these flares when we can't really do all that much. But I do want to remind you guys that the healthcare team are absolutely there to support you during those times. They have a lot of expertise to help you navigate those ups and downs and adjust treatments as they're needed. So they're there to really provide that guidance and make that journey as smooth as possible. What they're ultimately aiming for is remission. So remission is key treatment aim, being that in time, medication can hopefully help that child's disease become inactive to the point where a child experiences very minimal to no symptoms. Because it's autoimmune, we don't really have any cure. We aim for remission, and that's a very positive, it's a very achievable goal in the management of your child's arthritis. So what kind of flares are experienced and how they're treated really depend on what type of JIA they have. So in the very beginning of your JIA journey, and I'm not sure how many of you are at that point where it's just all brand new to you. This information is foreign. Hopefully we can close some of those gaps, but this is a conversation that might have already happened or it will be happening. Often the rheumatologist will talk about the subtypes of JIA, and in this slide you can see there's several different ones. There are 3 major types that are most common, and I'm just going to speak to those one at this point, but they're systemic, oligoarticular, and polyarticular. So the types of arthritis that they're diagnosed with usually depends on symptoms, but it also depends on how many joints are being affected. So they look at that medical history and clinical presentation. Systemic JIA affects both large joints and small joints, and it affects 1 in 10 children. So it's the less common one than the 3 major subtypes, and it does affect more females than males. But the inflammation not only affects joints, sometimes it can affect other parts of the body, and it can manifest non-contagious fevers and rashes. And this is why it can actually be misdiagnosed, and it can be confused for other things like measles or sometimes chickenpox. Oligoarthritis is the more common subtype of JIA that actually affects around 50% of the JIA population, and it affects females more than males. Now, with this one, it's oligoarticular because it affects 4 or fewer joints in the first few months, and it typically involves those larger joints like the knees, the ankles, the elbows. You'll see here there is a risk of uveitis, and I'm going to talk more about this uveitis shortly. But I do want to go through the 3rd major subtype, which is polyarticular arthritis. So this just means that there's 5 or more joints affected in the first 6 months of illness. Usually this type of arthritis will affect the smaller joints, usually in the fingers, in the hands, but it can also affect the knees, the hips, the wrists, the neck, the jaw. And it affects a quarter of the JIA population, anywhere between 15 to 25%. So kids with this type of JIA will either have a positive rheumatoid factor or a negative rheumatoid factor. All this means is that if they're positive with a rheumatoid factor, that will prompt the healthcare providers to just more closely monitor the condition, to look at which medications are needed to mitigate the longer term risks. There are other types that are less common, like enthesitis-related JIA, psoriatic arthritis. And then there's one that's not actually listed here, but it's undifferentiated arthritis, meaning that it doesn't actually fit into any one of these categories. But the reason why I talk about the subtypes here is because it's so crucial for tailoring treatment, long-term management, and setting appropriate expectations with your healthcare team. And it can help even enable early intervention. So the more knowledge we have about this condition and different subtypes, it can help with really taking a more effective approach to JIA long-term care. So the prognosis is something that we've probably all thought about at some point. And I want to say that it can vary significantly depending on what subtype they have. But because of how far we have come with medications and treatments and how much more we know about the condition today in comparison to what we knew 20 years ago, the outcomes have drastically changed and they're substantially more favorable for our kids today. Usually when you go to the doctor and conversations are raised around medication, it's completely normal and valid to feel worried, scared, concerned, have a lot of questions, because we just want to make sure that our child is safe. But what I want to do is just assure you today that the treatments are very, very effective at preventing the disease causing long-term irreversible damage, which is what you can see here in the progression of symptoms. Usually it can start with synovitis, that can lead to joint destruction and then have longer-term implications for the bones, the tendons, and ligaments. which now we know the treatments are so effective at halting that and preventing that from progressing. So usually in the interventions, usually they'll talk about first-line therapies, and this often includes non-steroidal anti-inflammatory drugs. So these treatments are usually aimed at managing symptoms and reducing inflammation. And a lot of children with JIA actually respond really, really well to these therapies. Some of the research we have suggests they can achieve a remission or a state of low disease activity quite quickly. And for some kids, that's all they actually need. Some children will even enter adulthood completely in remission as a result of early intervention. So that early intervention is pretty key here. If a child's JIA is more severe and they haven't responded adequately to first-line treatments, and that's quite common as well, the rheumatologist might go down the path of second-line therapies. And this is where we talk about disease-modifying anti-rheumatic drugs, and you'll see them in the internet known as DMARDs. And one that might be familiar to you is methotrexate. So methotrexate is interesting because it suppresses the immune system's overactivity. And what can be scary when it comes to this medication is that there's information around it being used as a chemotherapy drug. Historically, they were used to terminate ectopic pregnancies. I'm pretty sure that's the history of it. But studies have consistently shown that it's very safe, it's very effective for juvenile arthritis, which is why it's very commonly prescribed in JIA, and it's got a very safe track record over 2 decades. So I'm going to talk a little bit more about that medication shortly. Another second-line therapy, if DMARDs don't work sufficiently, we have biologics as well, which is a different type of disease-modifying anti-rheumatic drug. You've also got corticosteroids, and these type of drugs are a little bit more targeted, but they can be highly effective, especially in polyarticular or systemic JIA. And so what I want to highlight here is that there are a lot of different treatment options available that can be safely explored. And so how do you choose the right medication for your child and work with that healthcare professional? What I want to show you here is the balancing act of treatment. So ultimately, choosing the right medication for your child is a balancing act because it involves finding the right treatment that effectively manages the disease and halts that inflammation, while minimizing the potential side effects and the risks. So medication is ultimately taken to prevent or slow down that damage to joints, prevent the progression of illness, reduce symptoms, and it's very key to preserving movement, maintaining its function, and making sure that it doesn't go uncontrolled, which can result in joint damage, potentially deformities, and impaired physical function. It would be ideal if they could work almost immediately. It would be ideal if they could be 100% effective, but doctors also want to ensure that they're preventing or at least reducing the risk of side effects as much as possible in both short-term and long-term. So in the beginning, it can be one of these processes that are really tricky to figure out which one's benefits are weighed over the negatives, but that's what the rheumatologist and healthcare provider are there to do. Doctors want to also make sure that the medication is safe during growth and development periods. They want to make sure it doesn't hinder or disrupt the child's natural growth trajectory. And they also recognize that physical health is very closely linked to psychosocial development. So the safer the medication is, the more it's going to help maintain physical and mental well-being. And it's going to help children focus on their emotional and social growth without any added stress of uncontrolled JIA symptoms. And what type of medication is selected really depends on how old they are at onset, how aggressive therapy will be, how long it's required for, physician's preference, parental preference as well, practical issues, maybe other existing conditions, like if there's any other autoimmune conditions, like IBD or Crohn's. And I guess another thing to factor in is with the cost of living these days, the medication should be affordable and available. So remission of symptoms is absolutely possible when treatment starts, and it's absolutely possible for your child to go on and attend school, play sports, play with their friends, live a very normal, active lifestyle. And we want to assure you that that's also the goal of every healthcare provider who is involved in your child's treatment. There we go. Okay, so this is a list of medications we have here. How doctors decide which one is best for your child really depends on all those things we just went through, but also how quickly the diagnosis has been made, and then they aim to turn off that inflammation as quickly as possible to prevent any damage in the joints, and they want to aim to keep that inflammation switched off. All the medications in the toolkit have different mechanisms of actions and purposes. And as a parent, you probably want to know what those medications do, when they're needed, and how they're going to help your child. So what I want to quickly touch on here is the role of analgesics. This is a very basic pain relief. You can get it over the counter. These don't modify the course of JIA. They're just typically used alongside other medications to manage inflammation and prevent long-term joint damage. You might have heard of osteopanadol. That is a type of analgesic that's used for temporary pain relief. It's got its benefits because it can help your child get on with the day, can help them get through an activity if it's an important priority for them. So analgesics definitely have their benefits, but the more intense treatments that are required for the inflammation follow these different treatment options. So we have non-steroidal anti-inflammatory drugs, which I mentioned are very beneficial and often used as a first-line intervention for children. These help not only manage pain, but mainly reduce inflammation. They won't really alter the course of disease, but they can be very effective when they're used appropriately. Their side effects do really need to be monitored, but other than that, usually they're given as a first-line intervention. Steroids are more designed to switch off that inflammation, but the thing about steroids, they can have long-term side effects, and I might touch on those very shortly. They can change sometimes a child's appearance, increase appetite, and ideally they're used for short periods of time, but they can very effectively just switch off that inflammation when it needs to be switched off. As for conventional disease-modifying anti-rheumatic drugs, they're there to modify the course of disease, reduce inflammation, prevent joint damage. Now, methotrexate, I said, has a very long safety record of about 2 decades. Sometimes it's used by itself, but sometimes it's also used with initial pulses of steroid medication to achieve rapid disease control. There can be a few side effects like nausea, vomiting, loss of appetite, but there's actually, they're often managed with a folic acid supplementation, which not only works great for managing those GIT symptoms, which can come about as a side effect, but they can manage other side effects as well. It doesn't actually interfere with the treatment's efficacy, but regular monitoring is essential if your child is on this medication. We have biologics as well, which is another type of disease-modifying anti-rheumatic drug. It's designed to neutralize specific molecules in the immune system that are responsible for inflammation. So the tricky thing here with this type of medication is that it's very limited in the pharmaceutical benefits scheme, which is how the main public subsidy we have for a lot of medications. Some rheumatologists will have extensive experience with all these medications and have a lot of different options if that first choice does not work out. And so what you'll see in this list is that they all have their pros, they all have their cons, but your rheumatologist is really there to guide you through the process, ensuring the best care for your child. When you understand the different classes of these medications, you can have really informed discussions with your doctor, and it allows you to make the best choices for your child. So just remember that those treatment decisions are always going to be based on weighing the expected benefits with potential harms, but your doctor will be able to help monitor and determine what is the right medication at that point in time to not only like reduce the pain, reduce symptoms, but improve overall quality of life and prevent any potential harms from side effects. So communication and compliance is really, really important when it comes to working with your child around medication. So these are all the parental challenges that are very common when a child has to adhere to their treatment plan, and medication adherence is a big one. So ensuring that your child consistently takes their medication as prescribed can be a little bit challenging. I'm not sure if some of you are going through this at the moment. You might notice this as they're getting a bit older. Young children, on the other hand, might be a little bit more resistant, and this could be because of the taste of oral medication, or maybe it's because they forget, or they've got other things they're more interested in doing. But to understand this better, if it's oral medication that you're having troubles with, really helpful tip I heard from someone is that you could actually try tasting the medication a little bit yourself. So just when you're making it up or crushing it, you could put a little bit on your finger and just put it on your tongue so you understand what that taste is like. A lot of the time when children aren't excited about taking their medication, sometimes it's all to do with the taste. But if you really wanted to, you could go to a compounding pharmacies. They can make up a lot of different flavors to make it a little bit more palatable. If you have a younger one who's really struggling with their oral medication as well, it's important that you do your best to educate them, and you work with your doctor to educate the child. And what they want to be able to do is make the connection to understand why they should be taking the medication and its benefits. So I even had a look online and a little Google on Amazon, and there are actually a few different kids books or kids, I saw some ebooks as well, and even on YouTube, some fun animated videos that actually explain the benefits of taking medication when they're in pain. You could try other methods like reward charts, sticker charts, and positive reinforcement with age-appropriate language. Medication scheduling as well. So as a parent, it can be really tricky sometimes to juggle multiple medications, and especially if they're taken at different times of the day. But compliance is super important. And so keeping track of these schedules, we recognize, can be really overwhelming. It can be challenging. But we would encourage you to create an organized medication schedule, or set alarms or reminders on your phone, which can help with prompting medication administration, or share that schedule with other caregivers to ensure that consistency. Now, side effects. Now, I guess a lot of JIA medications, particularly steroids and biologics, can have side effects. And I guess what we need to do is be able to monitor those side effects and communicate with the healthcare provider, the rheumatologist, if you have concerns about them. It's really important that you not only communicate openly with those doctors and nurses and just anyone involved in that healthcare team, but you communicate, I guess, those concerns and anything unexpected that has arisen. Often the teams, you'll find, are very lateral. They're able to help you explore alternative options. They're able to make adjustments. especially if those side effects are severe. But it's really important that you let them know everything that you are doing in your child's day-to-day, everything they're doing around medication, including taking potential herbs, taking supplements, medications. The only reason we encourage you to really communicate honestly and openly about them is because they can have contraindications that we don't realize. And so what the doctors and pharmacists can do is just make sure that they're going to work in conjunction with the medications and not cause any worse symptoms or exacerbate anything. I'm not sure if some of you are dealing with needle phobia. So some JIA treatments, especially biologics, involve injections or infusions. And it's very normal for children to have a fear or anxiety around needles. Sometimes it can come about from the parents as well, that nervousness around the needles. And sometimes that nervousness can be worse than the injection itself. So as the parent, even though we're feeling really nervous and anxious inside, it's super important to just stay cool, calm, collected, because I guess that anxiousness can rub off onto the child. And if you want to try other ways of overcoming this needle phobia, have them involved in the preparation process. The rheumatologist or the person administering the treatment are really great at, they can be really great with working with children and helping them overcome fears and help them prepare ahead for the injection. And if they're prepared, they're going to feel more ready, they're going to feel more empowered and in control. So it's going to kind of help reduce that anxiousness there. Now, financial challenges, I said the pharmaceutical benefit scheme is the main subsidy for medications here in Australia. Sometimes hospitals may have a program where that might be available to you, but you do have to ask your rheumatologist about availability of these. But medications we recognise can be costly even with insurance. And so you may need to navigate financial aspects of treatment by going through what's inside your insurance coverage if you have it. Monitoring and blood tests as well. I guess a lot of JIA medications require regular blood tests to monitor potential side effects. And I guess what we need to be able to do is coordinate the tests to ensure the child's safety. So I guess going back to the importance of it, having an organised schedule, a regular schedule, and coordinating them with healthcare appointments is just one simple way we can help keep track for monitoring purposes. Using a calendar or a simple reminder app on your phone, if you have an Apple iPhone, you can use a health app. These can actually be very effective for tracking upcoming tests and appointments. The other things that can be really challenging for parents are more to do with the social challenges, and I want to spend a bit of time talking about them, but education advocacy, social school challenges, and the transition to independence. What might be, I guess, just a final touch point here is that don't be afraid to ask a lot of questions or raise concerns with your child's doctor. What is also helpful is talking to other parents about their experiences and how they've handled certain challenges. Usually parents have great advice, more to do with their lived experience of how they've dealt with challenges and overcome them. And there can be some really helpful tips that come through that way. Something I mentioned before is uveitis, and I'm going to talk a little bit more about this now. It's a very significant and a common complication in juvenile arthritis, particularly in that oligoarticular JIA. So it is relatively common in children with juvenile arthritis, with a higher risk in certain subtypes. And statistics can range from 8 to 40%. So that is a considerable proportion. What this highlights to us is that routine eye monitoring is a very critical part of the management. Uveitis, if you haven't heard of it before, is inflammation that affects the inner part of the eye. And this region includes iris, ciliary body, choroid. I'm not going to go through the anatomy of the eyeball, but what can happen is it can lead to eye complications if it's not treated promptly. There's just some general risk factors for uveitis being gender, age at onset. If they're diagnosed with arthritis before 7 years, they are just automatically at a higher risk of developing uveitis. All this means is that closer monitoring needs to take place. The subtype, and even having a positive ANA is a significant risk factor as well. So children who test positive for ANA, they're just at a higher risk. And so the positive thing here is that with early detection, timely intervention can take place, make it so much easier to prevent any of those complications that we talk about associated with arthritis. Just allows us to be a little bit more vigilant with the eye monitoring, and we can catch it in its early stages. The only tricky thing with this condition is that it can be asymptomatic, meaning that it might not display any noticeable symptoms. So a late presentation of uveitis isn't uncommon. It just highlights that point I made about frequent ongoing monitoring. So in uveitis, inflammation of the eye can lead to structural complications like cataracts, glaucoma, macular edema, retinal detachment, optic nerve damage, band keratopathy. There are a few things listed here, but these complications can result in vision impairment or loss if it's not treated. So really, we want an early diagnosis, prompt treatment, and regular monitoring to mitigate some of these challenges. So the assessment is usually done by the ophthalmologist, and it usually involves a very thorough specialized examination of the eye. And if there is a diagnosis, it can be treated very effectively with topical steroids. Eye drops is the main treatment, but in more resistant cases with treatments being methotrexate or biologics. So there is a close collaboration that's actually required between the ophthalmologist and the rheumatologist. And so they'll work closely together. Now, depending on several factors, including the promptness of diagnosis, specific type of uveitis, choice of treatment, and individual responses to therapy. Now, the frequency of ophthalmologic screening is determined by the degree of risk. So you can see here, if your child has oligo or polyarticular onset, they're younger than 6 years old, and they have a positive ANA, usually screening frequency would be every 3 to 4 months. That would be ideal. These guidelines are actually taken from the American Academy of Pediatric recommendations for uveitis screening, but they're used here in the Royal Australian College of General Practitioner guidelines. And so we definitely encourage this screening frequency. So you can see the screening frequency is either going to be quarterly, biannually, or annually, depending on subtype, age, and ANA positivity. Now, did you know that there are many other therapies available to manage symptoms? So whilst the medication and the ongoing monitoring is absolutely essential for our long-term outcomes, we want to recognize the equal value of the physical therapies, nutrition, occupational therapies, even psychological therapies can play a role. And now the choice and the combination of therapies and interventions should always be individualized to the unique needs of the child, but a multidisciplinary approach is always going to be better for more comprehensive care and support for the child. And so this is the best way to prevent complications, so your child can go on to do all the things they want to do in their age bracket. Now, according I'm going to start with talking a little bit more about physical activity here. According to our 2023 World Health Organization physical activity guidelines, they recommend that children engage in at least 60 minutes a day of moderate to vigorous intensity physical activity. Does anyone know what this type of physical activity is? Usually when we define this type of physical activity, we're thinking about activities that get that heart rate up. It results in very heavy breathing and exertion. It should be the type of exercise that they're doing and they're not able to continue holding conversation with their friends while performing them. And so what I want to highlight is that these guidelines apply to most children, but kids with juvenile arthritis are included in that, and they should be aiming to meet these. There are so many long-term physical benefits of exercise. Not only is it going to be protective for their bone health, their muscles, ligaments, it's going to be protective against chronic diseases like cardiovascular disease, diabetes. It also has very positive effects on mental health, which is very important for children going through school and high school and their cognitive development. What's interesting, every time you look at the statistics in Australia, we have a very low percentage of children who are meeting those guidelines, and that's children without juvenile arthritis as well. And although we should aim to achieve those guidelines, there are a lot of barriers that we have to acknowledge and recognize that are going to maybe prevent your child from achieving them. And so we do want to be realistic around what our children can do. And I guess there are aspects of the condition that are going to make it difficult to achieve them. And it could be pain. It could be when flares arise during periods of time, when you're trying to get them stable on medication or get that disease activity under control. It could be due to worsening bouts of worsening pain. Another barrier for exercise can be fear. So this could be because maybe in their past when they engaged in an activity or exercise, they endured an injury. It can make them scared to do that same activity again. Or it could be fear from the parent, where parents fear that exercise will exacerbate pain or it will lead to a flare and set them back. So parents can very easily worry that certain activities could harm their child's joints. But with exercise, the reality is the risk of a musculoskeletal injury is always going to be there, but exercise is not going to set your kid back, and it's not going to exacerbate any pain. It's not going to worsen their condition. It's really just about finding that balance between rest and activity. And as your child becomes more capable of recognizing their own physical limitations, they're going to be better at knowing when they can't exercise, but when they should be able to exercise. And I guess with the risk of musculoskeletal injury, it's always going to be there. Every kid is prone to them. They're always going to be prone to twisting an ankle, developing a knee pain or muscle pain after overdoing it. But that's not any reason to fear exercise or fear that physical activity will worsen their condition. Another barrier can also be low motivation levels, and it could be just due to other increasing priorities. So as they get older, school takes more priority, the volume of homework becomes a lot bigger. Maybe it's lack of interest. Maybe they just don't enjoy certain activities or exercise. So I guess they're the most common barriers that we see. And what's important to note is that we have to work with the child to overcome these and find solutions around them. And what we want to highlight is that doing any exercise is going to bring more benefits than none at all. Even if it's below the recommendations, exercise and physical activity is always going to be more beneficial for not just physical health, but the long-term management of their condition. So with JIA, you can work closely with the physical therapist to address these barriers. It's important that they're personalizing the exercise routine and doing activities they genuinely enjoy. Individualization is really key here. It's important they're able to set goals with a physio. So collaborating with a physiotherapist to establish very clear goals and a plan to achieve them. Their expertise can be very invaluable here. Now, I also want to emphasize on the importance of the fun in physical activities. If it's not enjoyable or meaningful to the child, it's less likely to be sustained. And if it's not fun or they don't see a reason to do it, it's very likely they're not going to do it. So it's really important that there is an element of fun and enjoyment, and it's built around the child's preferences here. Taking it one step at a time. So we encourage gradual progress by breaking activities into manageable steps. And I guess this kind of overlaps with pacing. So I guess with JIA, symptoms can be a roller coaster, physically, mentally, emotionally. Pacing is just one of those techniques that can really help. By taking a step back, it can make exercise, physical activity more approachable, less daunting, and safer for them to engage in. Now, with reconnecting with interests, it's important they're reconnecting with activities they love, and it's about helping them find activities that are in line with their interests, their values, and capabilities. And this is where, when we talk about skill mastery, it can be really valuable to help them find activities that are around their strengths, their capabilities, and help them master skills that maybe they missed out on due to the disease activities, and maybe they have goals to master them. So it's important to find out what those goals look like. And so this is where I think the more we can understand about this condition, the more we can get sports coaches, PE teachers, the better the outcomes are going to be for the child. So it's really important that children are able to get back into their sports or participate in PE and get that physical activity up. But it's important that they know they can participate at their own discretion as well. And there are special adjustments that can be made if they're needed. So that might require you to have a conversation with the teacher, with the coaches, whoever it may be. But occasionally there will be special adjustments that are required for the activity. So I do want to highlight that they are going to have better days than others, depending on things like timing of exercise, duration, intensity, frequency, how they're feeling. They may or may not be able to participate, but it's important there's really a good understanding and agreement how the child will be integrated into the activity. That's why that dialogue is so important with coaches, teachers, especially PE teachers. Now, JIA can affect different joints in the body, and their ability to participate in sport or any physical activity can depend on all these factors listed here. Affected joints, pains, stage of medical treatment, contractures, age, previous and current levels of physical activity, and of course the environment. All these things should be considered, which is again why an individualized approach can be important. And the key is really to provide that safe and supportive environment for your child to stay physically active while managing JIA symptoms. So it might just be a matter of teaching kids how to use proper joint protection techniques during exercise, or on days when symptoms are worse, they may need to engage in gentler activities or even take a break. As a parent, you can take that proactive approach to watch out for your child's symptoms so you can help keep them under control. But also don't ever fear that the exercise or a physical activity will exacerbate symptoms or increase the risk of a flare. The fear can usually lead to hesitancy and uncertainty around exercise, but there's so many different strategies and solutions to manage all these things listed here and help the child return to usual activities with their friends, including sport, as soon as it's appropriate. Just with nutrition, there's actually no scientific evidence to suggest that any specific food or diet can cause or cure juvenile arthritis or cause disease flares. But while some individuals, JIA, can find that certain dietary modifications can help with overall health and well-being, the greatest priority for the child is making sure they eat a well-rounded, healthy diet packed with the nutrients that will support and contribute to a normal growth and development pattern. So it's really important children are meeting calcium requirements, they're meeting their iron requirements, eating enough energy for their weight and height. And we're also focusing on nutrients that will protect bone mineral density and protect against osteoporosis. And so all these things, eating enough energy, eating enough calcium, iron, protein, all these things can help with that protection. There are just a few barriers I want to highlight here in nutrition, that some within our control and some without our control, outside of our control. But as parents, it's really important that we understand that some of these, especially if your child is in a very susceptible stage of growth in childhood, or you're noticing changes in their feeding behaviors, it's, I guess, important to recognize where they could be coming from. And this is why I want to go through this list here. So starting with medications, there are a few ways they can actually impact on your child's nutrition. Some medications can interfere with absorption of essential nutrients. Some can interfere with things like energy production, and they can cause nutritional issues and deficiencies. So this is why they can result in things like low energy, low mood, poor concentration at school, disinterest in play. And so it's important that if your kid's on medication and you're noticing these behaviors become more prominent, that maybe they just start with getting their bloods checked. So things like NSAIDs are known for depleting things like iron and folic acid. Steroids can interfere with calcium absorption. It's really important to get that assessed closely. Some other medications can also cause changes in taste perception. So don't be offended if your child does not enjoy their meals sometimes and they're refusing it. It's just some medications can lead to a metallic or a bitter taste in the mouth, which can make foods a little bit less enjoyable, and it can affect their appetite. You have medications like methotrexate, which can cause loss of appetite, nausea. This can result in reduced food intake, reduced food refusal. And on the other hand, corticosteroids can result in an increased appetite. And this can eventually lead to weight gain. But it's really important we put these things on our radar, because it can be a very vulnerable time for your child to be going through these body changes. And with puberty on top, we want to ensure that they maintain a healthy body image within themselves, but also maintain a healthy growth trajectory, being a healthy weight for height. Now, on the psychological side of things, comfort eating isn't a known response to the challenges and emotional stress associated with JIA, but children are susceptible to it. It's a common response to things like frustration, being in pain, sadness, anxiety, boredom. The challenges with comfort eating is they often involve high-calorie, sugary foods, which can provide a temporary relief from the discomfort, but can have longer-term implications. This is where we really talk about the importance of engaging a dietitian or a nutritionist who is an expert in food and nutrition. Not only can they help promote a good health through proper dieting, but your dietitian can work with you as a parent closely to work around special dietary requirements. They can talk about supplementation, and their recommendations will be based on an individualized assessment of your child's nutrition and factor in what medications they're on, what medical conditions they have, and what they're experiencing. So these are just some general nutrition tips here to make things a little bit easier with these potential challenges and barriers. If you're the primary meal provider in the household, you can start with emphasizing whole foods in the meals. You can also educate your child about the role of nutrition in managing their condition, help them understand how foods can support health and well-being, and just be mindful of the language that we use around food, making sure that we're using a positive language around foods and reinforcing that positive relationship with food. Now, being patient is really important because there's going to be days where they're experiencing pain and discomfort, which can affect their appetite. And so we do have to be understanding, and we can work around these by maybe at mealtime including their favorite foods, even if they're not as healthy, but at least they have variety. We always want to include at least one of their favorite foods to make sure they get food in, even when their appetite is limited. We can talk about modeling good habits and the importance of demonstrating healthy eating habits, encouraging your children to get involved with cooking, so making that mealtime enjoyable. By having them involved in cooking, buying, preparing food, it can help them feel more in control of their diet, and involving them in grocery time is a great opportunity to teach them about nutritious food choices, and we can take their condition into consideration. Now, reducing those empty calorie foods, the sweets, the fast food, salty snacks, processed foods, this can be done by keeping your home stocked with nutritious foods. If there's no unhealthy foods available in the kitchen, children are more likely to just opt for the healthier snacks. Healthy snacks can be the cut up fruits, vegetables, yogurts, nuts, for that in-between nourishment. So nutritious snacking can be achieved if they're eating smaller amounts more frequently as well. This might be better for managing times when they have a reduced appetite and they're struggling with feeding behaviours. Occupational therapists, they also have a really crucial role in the management of JIA by aiding in preservation of joint mobility function. They help you as a parent understand what activities your child can do, how to work around current limitations, set goals, increase motivation for healthier behaviours, and they're there to share advice and techniques on how to do something more easily and safely. And what we know from our research is that the outcomes of children with JIA are notably enhanced when occupational therapists possess specialised training and experience in paediatrics. So the benefits of working with an OT are endless. They are able to help with providing assistive devices, offer psychosocial support by addressing emotional and social needs. They teach energy conservation, which can be very valuable for school time. They can provide education to the children about their condition. They can also educate other people in the family about the disease, its management, and how to perform everyday activities. They can also provide school support. So what's really, I guess, important here is they can work with the teachers and school staff to ensure that the child's needs are met. So that child can fully participate in school activities, given that the adjustments and modifications are made when they're needed. So they can help with educating the teacher about special accommodations like slanted desks. They'll talk to them about rest time. They can talk to them about what to expect around exam time. And so what we want to highlight here about school support is that with JIA, kids, just like adults, thrive through interaction and learning. So they don't like to be singled out or thought of as any different to the other kids. So kids with JIA just want to be treated like any other child. And so what we want to do is maintain as much normalcy as possible. And as the parent, you can really help them understand that while there are some accommodations that might be necessary in the classroom or in the schoolyard, at home, in sports groups, it's important for kids to also learn how to manage their condition and make their own decisions whenever it's possible. And that's just to promote their independence. Within the school environment, teachers play a really vital role. And so it's important that they're informed about JIA. So as a parent, you can advocate for your child without that, without being overprotective in the way that makes sure your child has access to resources and support they need without limiting their experiences or disrupting that normalcy in any kind of way. So we can let the child's teacher know about their condition, what it entails, and how it might affect their daily activities, but also making sure that the teachers are supporting inclusive activities where their children can participate alongside the peers in more subtle ways as well. Occasionally, there will be special adjustments needed, but this is why it can be really valuable to have the occupational therapist and the physiotherapist attend to those parent-teacher meetings. They're there to help overcome challenges, open up that dialogue. They can provide really valuable insights. And when they're working with the teachers, it's not really about making the child stand out in any way, but it's about ensuring they have the best possible learning experience and normal learning experience. Just some examples of what teachers should know about to help manage symptoms in the classroom: medications and pain relief. They should have emergency numbers on hand. Classroom limitations. So there might be times in the semester or the term where the child needs to undergo NAPLAN testing. They are able to get extensions or special adjustments made. So this is where it's important to really let the teacher know that this might need to be possible because they might have difficulty writing for those extended periods. If homework is delayed, that can be expected because maybe they're having they're experiencing worsening symptoms. As for PE can be really challenging, but it doesn't have to be. PE teachers can actually work with the child and the parents to make necessary adaptations. And this is by modifying the activities, allowing for rest breaks, and providing alternate tasks or activities to the child to make sure they're still involved in the activities and the groups with the other children, and getting them participating in ways that aren't going to exacerbate the symptoms or isolate them in any way. It's just giving them a different type of activity to get involved with. Rest periods, there might be times where the child actually needs to take a break, they need a quiet space, and so the teachers should be able to assign this space and have that available for when the child actually needs that. For psychosocial support, it's really important that they're able to understand the challenges around managing the condition, and they should be able to create an inclusive and supportive classroom environment and offer the emotional support to make a significant difference. Now, regular follow-ups. Children with JIA then need regular medical checkups and treatments. So teachers really need to understand the importance of these follow-ups and be really accommodating when scheduling assignments, homeworks, tests, or have expectations for the child to attend outside of school hours activities. There are so many different ways to actually help your child cope with a chronic condition, and it can be challenging, but your love and support goes such a long way in navigating these challenges. So I would encourage you to have an open, honest dialogue between yourself and your child about their condition involve them in decisions about their treatment and needs. This helps kids feel empowered and in control. It also gives you a sense of relief knowing that they're developing their own autonomy here. Age-appropriate education, this is always going to be important and tailored to what age group your child falls in. But again, kids respond better to things like medication, exercise, nutrition, if they can make the links as to why these things can benefit them. And this can help them be more motivated and compliant. We do want to support their independence, teach them as much as we can about their medications, symptoms, self-care routines. And of course, again, this is going to be largely depending on their age, but gradually involve them in the decision-making about their treatment. Establishing a consistent routine for your child's daily activities can be really valuable, including medication schedules, exercise, and rest. Just having that sense of routine and predictability can reduce any of those external kind of feelings of stress and anxiety and anxiousness, you know, on top of, you know, everything else. Maintaining a positive outlook. So we want to really foster a positive attitude within the family. Focus on your child's abilities and their strengths, as opposed to limitations. So just remind them that they're very strong, resilient, and an amazing individual, that it's very normal to have challenges in life, but often when we maintain a hopeful, optimistic attitude, it will help overcome those challenges. So advocating for your child while avoiding overprotectiveness. This is really interesting because it can be a delicate balance, and sometimes we need to ensure that that balance between advocating for our child and allowing them to develop resilience is achieved. It's a little bit like parenting styles. On one hand, you can have a helicopter parent, which can be really hindering to problem-solving abilities by, you know, removing obstacles in the child's life. But on the other hand, we can have free-range parenting styles, which takes things to extremes where, you know, it can lead to dismissal of important things. But there's no right or wrong way to parenting or managing your child's arthritis. What's really important is that we adopt a supportive parenting style, meaning that we're there for the child when they need us. We encourage independence, we encourage resilience. It means advocating for them by ensuring they receive care and support they need. And so we can foster independence, but they have a lot of capability to navigate their challenges on their own, and they can become more resilient in that process. So as children get older, most children will better understand their condition, what they're capable of, when it's time to slow down. And overall, your child should be encouraged to keep their life as normal as possible, to do all the things that kids do. This really helps with building self-esteem and feelings of control over their illness, which is what everyone is there to help with. Now, if you need to find health professionals who specialize in the area, a lot of these websites here and associations have a find a health professional option. You can see if any health professionals in these websites have special interests in juvenile arthritis. It can just help you narrow your search and find someone who specializes in this area. As for emotional support, it can be really challenging at times when your kid is going through things that you can't fully understand. You can do your best to understand it, but we all need support. We all need someone to talk to. These are great websites and hotlines that are available 24/7. They also have a lot of resources and information that can help you navigate mental and emotional challenges as a parent. As for additional supports, I guess isolated patients travel and accommodation assistance scheme. This is more relevant to people living in rural and remote areas. This is just a scheme that helps people travel to appointments in metropolitan areas. And so there's information about this scheme on the website. Centrelink, NDIS, although their supports are usually based on the level of care needed for your child, doesn't really apply to many children in JIA. And this is just because we recognize that kids with JIA are very capable to go on and live very normal, healthy, active lives. And usually these schemes only really apply to those people where care is a lot higher and there's a lot of other coexisting conditions. You can always look into these support schemes and services, but I just want to highlight that not everyone is eligible to access these. And so that support in that aspect is very limited. For information about juvenile arthritis, Juvenile Arthritis Foundation Australia, JAFA, and the Pediatric Rheumatology Network, so the PRN, very helpful, informative websites and organisations who are always, they're committed to the ongoing research in the JIA space and always there to provide information and support to parents with children who have JIA. As for our organisation, we run camps, we run events, and occasionally we'll put out information that is relevant to you. So if you aren't aware of Camp Twinkle Toes or Camp Footloose, we definitely have these events coming up. I would encourage you to check those out and see if your kid would be interested in attending those. And it's mainly because they're there to connect kids with other kids who also have JIA. It's there for kids to make friends with one another and talk about their experiences. There's also a lot of education for the kids to help them self-manage their conditions as they get older. Went a little bit over time there, everyone, so my apologies for that. Does anyone have questions? What I might do is just pause the recording for now.
Pretty comprehensively, so yeah, that was great. Thanks for that.
That's not a problem at all. I hope that was able to help clarify any questions you did have walking into this webinar, and I hope we were able to take away some things that might help with the ongoing with the journey you're now on.
I guess I just thought of one thing just regarding the eye test for uveitis.
Yep.
What age are you usually testing for that?
Okay, so let me just go back to my slide.
Staring up a tree.
I don't believe I have information about from when they can start getting tested, but it would be a good idea to just raise this with your rheumatologist, and it might just be from when they and just grow into their, because I'm thinking you have a younger child. It would definitely be 3. Yeah, it would definitely be encouraged to ask your rheumatologist from when they can start getting tested, because I don't think there is an age restriction that will prevent them from getting their eyes tested.
Okay.
And just because you have the knowledge of this, it just means you're better informed. You can monitor it more regularly, and it can lead to a promptness of diagnosis if it's relevant.
Yeah, sure. Thanks.
Thank you, everyone. If you have any other questions, you can always contact me directly through the health website, or contact me on the info line. We'll definitely be putting out more information about JIA as we go on throughout the rest of the year. Next year, there will be more webinars about JIA. So yeah, we're here to support you with any kind of questions or support you might need.
Thank you.
Great,
Thank you,
thanks
everyone.
again.
Have a great night.
Cheers. Bye-bye.
Bye.
Take care. Bye.